Luckily, with chronic enteropathy, though it is a really heterogeneous syndrome and it can present in a lot of different ways, luckily enough, the vast majority of dogs can achieve clinical remission with diet. And that's a statement that's really backed up by probably a lot of our experience, but also a lot of prospective and retrospective data from the US and from all over the world. If you're really able to keep kind of owners sticking with you and explain to them the potential benefit when we do find that diet that helps, we can get those numbers even higher.
Hello, VetFolio Voice listeners. You're back. I'm so happy you are. This episode is sponsored by Hill's Pet Nutrition and features Dr. Alison Manchester, who joined me to talk about the influence of diet in managing GI conditions. So let me tell you about my own dog for a second. He has never exactly had a stomach of steel. He's a lab, so he thinks he has a stomach of steel. He thinks he can eat anything, but soft stool, at least intermittently, has really been a part of his life kind of since puppyhood. And from my own experience, I can confirm that food plays a major role in keeping his GI tract happy, which of course then keeps all of us happy. So Dr. Manchester and we got into all of that. We talked about the ins and outs, if you will, of managing chronic GI disease in dogs. And we talked about how chronic cases differ from acute ones, why diet's often our best tool for long-term remission, and how fiber, attention to the microbiome, and avoiding that, that almost reflexive reach for antibiotics in these cases really plays into better outcomes in the long run. We also talked about some of the challenges that we can encounter with these cases, like what to do when we put together a plan and it doesn't work on the first try, and how to support pets and their owners through really trying to achieve long-term remission for GI disease, even if it takes a couple of tries with different types of food. Let me tell you a little bit about Dr. Manchester and we will get into our episode. Dr. Alison Manchester is a board-certified veterinary internist with a PhD focused on chronic intestinal diseases of dogs and cats. She studied art history at Tufts University before earning her veterinary degree from Cornell. After completing an internship at the University of Wisconsin, she went on to pursue an internal medicine residency and PhD at Colorado State University. Dr. Manchester became board certified by the American College of Veterinary Internal Medicine in 2018. Her studies involve utilizing advanced technologies and non-invasive samples to expand understanding of the gastrointestinal tract in health and disease across species. In addition to her research, Dr. Manchester lectures at CSU and presents at veterinary conferences nationwide. She's passionate about client communication and what clinical trials can teach us about improving patient care. She was very knowledgeable about everything we covered here, as I'm sure you will find listening to this. Let's go ahead and jump in.
Are you passionate about animals and love helping people? In the fast-paced world of veterinary medicine, exceptional client communication is just as important as quality pet care. As a customer service representative, you're the heartbeat of the practice, the first and last person clients see. You provide comfort, support, and trust in every interaction. This course is designed just for you. It's interactive and practical, featuring real-world in-clinic video scenarios, engaging knowledge checks, and printable resources to give you the tools, confidence, and strategies to handle any challenge and elevate the client experience. Register today for the Certified Veterinary Client Service Representative course on vetfolio.com.
Alison, Dr. Manchester, thank you so much for joining me. I'm excited to talk about there's so much I feel like happening on the GI front lately. So really excited to get into it.
Yeah. Thank you so much for having me. This is definitely one of my favorite topics to kind of think about and bounce ideas around. So yeah.
Yeah, absolutely. Well, kind of along those lines, with a lot going on this front, what are we looking at in terms of sort of the latest updates when we're talking about acute GI upset, whether we're talking about colitis or gastroenteritis? I feel like kind of the dogma around treatment of these conditions has changed definitely since I got out of school.
Yeah, I think that's a great place to start, first of all, because it's such a common condition that we see in practice. Yeah, it can be a real wrench in your day when you have these animals adding on. But I think we have some hope because there have been actually a lot of recent studies that have tried to really do head-to-head comparisons, often in a blinded, placebo-controlled way to see, what should we be doing, what actually helps these, especially dogs, feel better quickly. And I guess the thing I wanted to start off with in thinking about this is that the vast majority of these cases are going to be kind of self-limiting in nature. They're going to have non-specific causes. And so, with that in mind, as a clinician, I really want to think about what are the treatments I can institute that are going to hopefully help the animal feel better, help the client, sleep through the night, not have a huge mess in their house, but also do no harm. Because if we know things are probably going to get better on their own, the last thing we'd want to do is institute a treatment that might have negative, long-lasting effects. And like you said, I think there has been kind of a sea change in how we approach these patients with the recent evidence we have from controlled clinical trials. I think it's pretty well understood that the hallmarks and the kind of foundation of treatments are supportive care. For me, that's a bland diet, maybe some supplemental fluids, maybe some kind of fiber support. However, that does mean that probably we don't need to reach for antibiotics in most of these cases. I think in the few studies, there's been really minimal differences seen in terms of time to resolution. And so we also know that maybe not in every dog, but some dogs might have a really long lasting impact of even a short course of oral antibiotics on their gut microbiome, which might set them up for issues kind of down the road. So, really, acute GI upset, I'm trying to you know, make sure the animal's overall stable and then recommend either a therapy like a commercial or home prepared bland diet, maybe some fiber, maybe a probiotic if the owner really wants to do something. But I'm really going to try to, at all costs, avoid antibiotics that could really substantially and negatively impact the gut microbiome.
Absolutely. So it sounds like the major take home is reaching for these do no harm type of therapies, and that it doesn't sound like that includes antibiotics. Like antibiotics, it sounds like would be in a potential for, are we really helping and maybe setting this animal up for more issues down the road. Am I understanding that correctly?
Yeah, perfect. We know that especially metronidazole is actually quite broad spectrum and it's going to kill off most of those anaerobes that are in the distal gut. And those are typically really beneficial to the host. So it is a bit concerning if we kind of wipe all those organisms out. Maybe they'll recover, but that's not guaranteed. And I think that could set the animal up for a more unstable microbiome that might predispose them to another one of these episodes weeks, months later.
Sure. And I also wanted to ask you, I'm a big propectolin person when it comes to these cases. What are your feelings on that? I love like just the anti-diarrheal effect where I feel like I get a really fast response in those cases.
Yeah, I think that's great. Again, unlikely to do any harm, may help with symptomatic improvement, help the animal feel better because, no one wants themselves or their pet to be feeling like this. It's not a good place to be. And I think that that would be a really safe intervention to prescribe.
Well, that makes me feel better because I'm like, gosh, I really love it. But absolutely, in terms of a bland diet and fiber and things like that, I'm really excited to dive into that a little bit further. But before we go there, what about these cases? Certainly, I think what we're talking about here is like this isolated case of got into the trash or something like that, maybe stress or something set off a GI upset. We treat that supportively, they get better and away they go. But then there's these other cases where it may, that may be the case. And then maybe 3 or 4 months later, this comes back and it happens again. And then 3 or 4 months later, it happens again. So, do you change your approach at all when these cases start to become, I guess, recurrent might be the word that we're treating maybe several times a year?
Yeah, I think that's a really good point, and I feel like I see these types of cases. I think at the end of the day, a lot of it comes down to kind of the owner's tolerance of these types of things. Is it, a self-limiting 24 hours of diarrhea? Maybe they kind of have their supportive chicken and rice and their fiber at home. They're okay. Versus, this is happening multiple days on end. They're not eating. It might prompt a vet visit, and then the owner's saying, they're knocking on your door, they're scheduling an emergency appointment. And I think in that case, we need to kind of take a pause and think about, wait, is there something underlying that could be specifically treatable that is kind of predisposing this patient to have these recurrent issues? Is it becoming actually more of a chronic enteropathy? And in that case, that might change both the diagnostics that we offer, and then maybe we want to do actual management changes. Maybe we do want to change their diet, things like that.
And I love that you bring that up because that was kind of where my head was going next is, when we do start to see this recurrence, you mentioned like the owner's tolerance. Is it, just 24 hours of diarrhea and then the dog gets better? I have a lab who has never had great fecal score. And I have done some diet changes with him and it's helped, but he's just not one of these that's ever had great poops.
Mm-hmm.
And so, thinking of like fecal scoring charts and things like that, I'm wondering if you can expand on when we get to these sort of recurrent cases, what sort of differentials we should be keeping in mind and what sort of diagnostics we should be looking at to work these cases up.
Yeah, great question because, a lot of this conversation, I think we're going to be going to diet and how diet can be such an effective therapy for dogs with chronic enteropathy. But we have to remember that chronic enteropathy is pretty much a diagnosis of exclusion. And there's a few specific differentials that we'd want to kind of cross off the list before we kind of settle in that diagnosis. Things I think about trying to be somewhat organized in my thoughts. I usually try to think broadly, try to rule out extra GI causes for these clinical signs because, of course, things like liver disease, renal disease, endocrinopathies can manifest as these nonspecific GI signs. And so, with that in mind, I'm a huge proponent of a minimum database as a starting off point. Doesn't mean that every dog coming in with, 12 hours of diarrhea needs a $500 CBC Chem UA and all that. However, once this starts to become recurrent, or maybe they're having more abnormal stools than normal, it's really important to get that minimum database, typically consisting of a CBC, a chemistry panel, and a urinalysis to say, is there organ dysfunction? And then I also really use that to see if there's any hints, any red flags saying like, ooh, this could be a dog with Addison's, or this could be a dog with hypothyroidism, because both of those can really manifest as GI signs. And so that's kind of the starting point. Of course, we can layer on additional diagnostics after that and go into primary GI causes. That could include structural things. It could include infectious diseases, depending on where you're practicing. Here in Colorado, we are kind of isolated with our climate and with the altitude. We don't see a lot of really nasty GI infections that would be chronic. However, when I was practicing in Texas, I have a dog that's coming in with chronic large bowel diarrhea, maybe starting to lose weight. I really need to be thinking about things like histoplasmosis or heterobilharzia.
I'm glad that you bring those up because believe it or not, even in Florida, we are also somewhat a little bit isolated from those. And that's like one of the few infectious diseases that we don't have a lot of. So it is important to kind of get that reminder to keep those on our differential lists. What about doing like fecal diagnostics? I'm thinking, certainly float and centrifugation, but like Giardia testing and things like that. At what point do you recommend diving into some of that?
Yeah, that's a great point, and thanks for reminding me of that. I probably glossed over that, but I think, in that initial kind of first few presentations, we should check and see if they're shedding parasites. I think it's a little less likely, that dog comes in with like acute, severe bloody diarrhea. Most parasites don't do that. That's a little bit dramatic for a parasite to do. So maybe if you catch something, it might be more of kind of a concurrent infection rather than the actual cause. However, it does mean, especially if the dog's not on preventatives, again, here in Colorado, we get a little, I don't know, laissez-faire with preventatives at times since we don't have as much heartworm, though it's coming, I'm sure. So yeah, it's great to look for parasites. We can also think about empiric deworming with something like fenbendazole early on. That would not be wrong. I would say when we start to get into a lot more kind of sensitive tests, and I'm thinking like Giardia antigen tests, Giardia PCRs, and specifically with the pathogen that is Giardia, that can be a challenging one. I see a lot of patients that have kind of before I meet them, they've struggled with chronic giardiasis or being Giardia positive in their feces. And I'm not sure it's always like a cause and effect relationship. And so of course, we could treat the dog once, really do good environmental management, do good bathing, make sure the other animals in the house are treated, the yard is clean. But after that, if we're still not really able to clear that Giardia, I might start to kind of put it a little bit lower on my list and kind of focus on helping the gut recover as a whole. And that a lot of times does involve diet, which we're going to jump into here soon.
Would it be correct in thinking that focusing on the gut and allowing the gut to recover and kind of support, I guess, supporting the immune system might help with the Giardia and help the dog maybe clear that, maybe not clear it, but at least improve it on their own?
Yeah, that's exactly what I'm thinking about. I guess in my mind, I'm thinking of Giardia and some of these dogs, especially like those German Shepherds that I tend to see very frequently, that like the kind of the gut is, it's not healthy and it's not, the gut immune system is not working as it should, allowing sort of a hospitable environment for Giardia to stay around. But if we can kind of support the gut, I think a lot of times with fiber, potentially even with probiotics, can we kind of bolster the gut's own defenses and allow that giardia to kind of go away in a more, I wouldn't say natural, but a
It's sort
more,
of natural.
yeah,
Yeah.
yeah. Kind of just trying to avoid like just throwing tons of metronidazole and tons of
Yeah.
fenbendazole because, that can be tough on the patient. It can be expensive. And I also would say in personal experience, it just doesn't often work.
I was going to say the same thing. I'm like, yeah, we might be setting our patient up for trouble and not being successful
Yeah.
anyway. So that approach makes a lot of sense. And I'm glad that we talked about that a little bit because that's another area where I feel like the conversation is changing a little bit. So
Yeah.
I'm glad to include that here in our talk. Let's transition here to chronic enteropathy because you've mentioned fiber a couple times, and I definitely want to start to jump into some of the management strategies for managing chronic enteropathies. But before we do that, you touched on this a little bit before, but just for my own clarification, is there a certain kind of distinction where it goes from maybe what we would call a recurrent diarrhea to a chronic enteropathy?
Yeah, I think that's a good question. I don't have an amazingly tight answer for you, but when we look at textbooks and papers, they say chronic enteropathy is when these signs have been present for more than 3 weeks. But we know, at least I see a ton of patients that maybe they don't have diarrhea for 21 days straight. However, over the course of maybe 3 months, they've had, you know, every other week they have diarrhea. So I think it's a little bit of a subjective kind of diagnosis when you're applying that term chronic, but I kind of think you know it when you see it. If they've had issues kind of more often than not over the past few months, then I think they've earned themselves a qualification for the syndrome of chronic enteropathy.
I think that's actually a really empowering answer for GPs with there not being necessarily like a distinction. Because we know sometimes we have those distinctions and we're like, I really think this patient fits this diagnosis, even though, it's not perfectly in all the categories. So I do feel like a little bit empowering to say, when you see it,
Yeah.
when you feel like this is a chronic enteropathy, it's a chronic enteropathy.
Yeah, and maybe I'm more biased because I study and think about GI disease all the time. So I look at dogs like a dog that, doesn't eat breakfast most mornings. To me, that's almost chronic enteropathy. Like, I don't know. We grew up with dogs. I'm around a lot of healthy dogs, and dogs should be hungry all the time. So when dogs are being like picky like that, I'm like, I'm curious, is there something underlying?
Yes, I totally agree. And I figured I was just biased because I'm a Labrador person.
Hmm.
But yes, like it does kind of make me wonder sometimes when we get these dogs that get really, really picky,
Hmm.
what's behind that?
Right. Yeah. And I think about like people, most of us, given the option, if there's good food, we would eat it. So, we only have so many things to go on with feline and canine patients. And I think we really need to pay close attention to any kind of information they're giving us and take it seriously because I know for me, if I'm feeling not well enough to not eat, there's something pretty wrong. So,
Sure, sure. Absolutely. That's a great point. Okay, now I've teased it twice, and let's talk about managing chronic enteropathy and getting into some of the considerations around that. So, when we start to see these patients and we're like, yeah, this is falling into that classification of a chronic enteropathy, what should we start thinking about or maybe have been thinking about up to this point in terms of management?
yeah, so luckily with chronic enteropathy, though it is a really heterogeneous syndrome and it can present in a lot of different ways. Luckily enough, the vast majority of dogs can achieve clinical remission with diet. And that's a statement that's really backed up by probably a lot of our experience, but also a lot of prospective and retrospective data from the US and from all over the world. I think the published data would say it's maybe on average like about 60, 70%. But I think in practice, if you're really able to keep kind of owners sticking with you and explain to them the potential benefit when we do find that diet that helps, we can get those numbers even higher. And I think in the patients that I see, it's probably closer to about 80% of dogs that respond to diet. What comes next, though, is, well, which diet? And I'm just going to start off and say that there is no one single diet that's going to help all dogs. I think a lot of times when I finish like a lecture, people come up afterwards and they're like, so like, what, like, it's almost like they think I'm holding back and not telling them like the one secret kind of silver bullet diet, but it really doesn't exist. There's different aspects of different diets that I think help individual patients, but a lot of this does require trial and error in order to kind of organize thoughts in this approach because it can be really overwhelming. We're really lucky, I think, in the United States to have a lot of high quality veterinary therapeutic and over the counter diets that should be highly digestible and could really help improve dogs' GI health. But this can be challenging to know where to send owners. And I think without recommendations from a veterinarian, a lot of times people go to the internet, they go to a pet food store, and that might not allow us to be as successful as we could be. So when I'm trying to organize my thoughts, I usually think about three big aspects that are going to divide out these different diets. And that includes kind of the macronutrient composition. So where the calories coming from in terms of protein, fat, and carbohydrate, and looking into the fiber content of the diet. I'm also going to think about ingredients and finally think about the format of the diet.
Format being like kibble versus canned or something along those lines.
Yeah, just because we know that, canned food is going to have a much higher moisture content than kibble, and that's definitely going to influence the way the gut sort of handles the diet. Within that category, I'd also think about kind of the distinction between commercial versus home prepared diets. I would say that home prepared is definitely not my first choice in the vast majority of patients. However, it's kind of something I keep in my back pocket, especially if, you have an animal with a lot of different comorbidities that might be sort of competing and make it difficult to find that one therapeutic diet that kind of checks all the boxes. And then also if you have, first of all, a really motivated owner, some people like all they want to do is cook for their dog. And, that's not going to be every owner, but some people like that's just what they want to do. They feel good about that. And finally, it can really help. I think we all kind of know some of those patients that they just look at dog food. They're like, I'm not going to eat that. So it can really help with palatability.
I think going back to your earlier point about dogs should be hungry all the time, I remember talking to Nicole Sheehan, who I like her take on some of the dietary stuff, where she talks about some of these pickier animals and she's like, this is a blessing. They're telling us like what it is that they're needing and they're wanting. And so I think circles back around to that home cooked place of when we do have this animal who's looking at commercial food and is like, no, it's not happening. To say, maybe there is some formulation out there that, we can have an animal who's looking forward to meals and is acting hungry all the time. So I'm glad you threw that in there as a category. I do think that's an important category to remember. Thinking of the macronutrients and also fiber content, I think I feel fairly comfortable considering fat when we're talking about maybe pancreatitis, prone breeds, or like lymphangiectasia, stuff like that. Fiber, I will be honest, I feel like is a little bit of a newer consideration for me when I'm thinking about diets in GI cases. So, can you give us some guidelines in terms of how to think about fiber when we're looking at a chronic enteropathy?
Yeah, I'm really glad you raised this point because I think we've mentioned kind of peppered in fiber a few times, but haven't really gotten into sort of the indications and the potential mechanisms as to why it might help. Fiber is definitely something that I think about a lot for these types of patients. First of all, because there's kind of a diverse blend of reasons why fiber might benefit an individual patient with chronic enteropathy. I think the first would be that fiber can kind of serve as a prebiotic. So I think of it as a really great way to try to kind of support a healthy gut microbiome and kind of provide the raw materials for the bacteria to work on and then make their secondary kind of metabolites that might further promote gut health, things like short chain fatty acids. Fiber can also be really helpful in sort of modulating and kind of evening out gut motility. I think some of our chronic enteropathy patients deal with delayed GI motility. Some deal with too rapid GI motility, and fiber can be a nice kind of like moderator of that motility. And that can really help with like normalizing stool quality as well as maybe keeping the animal satiated. I think, and I was just seeing a patient yesterday who I had just started on a very low fiber diet, and the owner did complain about some like stomach grumbling, and also that even though he's not losing weight by any means, he just like seems hungry all the time. And while that's again, I think it's a sign of health, it can be frustrating and kind of worrisome. Like, I don't know, I don't think we would be happy if we're feeling starved all the time. So fiber can be really nice to add that sense of satiety. I think the only kind of drawbacks that I'd think about in, much kind of more fiber rich diets, fiber is going to reduce digestibility to some degree. So if you have that, I'm thinking of like a German Shepherd who's like a BCS 2 out of 9 and has kind of like a picky appetite. You're not always sure you're going to be able to get your full RER into that patient. High fiber diet might not be the first place I'm going to start because I would worry we might not be able to make progress on like our improvement of the BCS, allowing them to put muscle back on due to reduction in digestibility. Other thing about fiber, it could delay gastric emptying, which, may not be an issue for a dog with normal GI motility, but I'm thinking of like a French bulldog I saw a few years ago that already had some evidence of like a delayed gastric motility. We added fiber to help with her large bowel diarrhea, and then she started puking like 3 times a week. So just little things to keep in mind. But overall, I think fiber can really be your friend in both dogs and cats to help with their GI signs.
Sure, that helps a lot in terms of when to reach for it and how to think about it. And also, I think echoes, like you said, some dogs things move too fast, sometimes they move too slow. So that sort of echoes my experience with fiber is I'm like, you add it in and
Yeah.
sometimes it makes everything better, sometimes it actually like makes the diarrhea worse and you have to find that right balance of fiber.
Yeah, one thing I wanted to chime in and say, just because we had a funny experience yesterday where one of our team members was trying to treat his cat's diarrhea and was adding a tablespoon of psyllium husk
Oh gosh.
every day for the cat. And to me, that's a very high dose of psyllium fiber for a cat. And it kind of goes against my general idea with fiber is I usually start low and maybe work up to the dose that I'm thinking might be my target dose over a course of a few days. Because just like with anything else, like with fish oil, you add in your what you think is your therapeutic dose kind of cold turkey, and it can really cause it can be a little shocking for the gut, I think. And just the only last thing I wanted to mention about fiber, and I think it does add to the confusion you were talking about, is that the labels on the pet food bags don't always reflect kind of the true fiber content of the diet. We have the crude fiber on the pet food label, and that's only going to represent a portion of the total dietary fiber. And that's actually the parameter that we need to know. So you really need to look at your product guides to get that TDF value, and that allows you to compare apples to apples between different diets in terms of their actual fiber content that's going to go ahead and kind of influence your patient.
Ah, that is a good reminder to know how to compare diets. Yes, I agree. That does sound like a lot of psyllium for a cat. I'm
Yeah.
thinking of, I also had a Frenchie experience where he was having some loose stools and we did psyllium and it was like a quarter teaspoon. And like when the stools got better, I guess the owners were still continuing the psyllium. And so it was like 2 months later, I got the phone call and they're like, he keeps waking us up at 4 o'clock in the
Oh,
morning to go poop. And I'm like, oh
yeah.
my gosh, stop the psyllium or at least
Yeah.
cut it. And it was like the tiniest little
Yeah.
amount. So yeah, that's good advice. Start low and work your way up.
Yeah. And that would be maybe something to warn owners when you start it. I think if they're having like liquid diarrhea, they're going to be okay if we get a form stool, but maybe they're a little more voluminous or they're more common. But yeah, just let them know there probably will be more fecal bulk. There might be more frequent bowel movements, and we can always kind of play with the dose to maybe find that sweet spot that helps them.
Sure. And, talking about dietary sources of fiber, are there specific diets that do tend to be higher in fiber for those patients that really do benefit from that?
Yeah. So yeah, we've talked a lot about adding psyllium into their current diet, but I think for some people, maybe some animals, they don't find that palatable. They have that powder mixed in. It can be kind of a pain to clean it out of the food bowl. It can kind of get stuck on there. And also, that's just one source of fiber. And a lot of our veterinary therapeutic diets have a much more diverse blend of fibers, which can have more like I don't know, different targets and additional benefits. And so the high fiber diets that I think about are things like Hill's GI Biome. I think that's important to remember. It's not in the name, so it may be forgotten that this is actually a really fiber forward diet. And I think it can really help a lot of patients, especially with large bowel signs, and it can help them have improvement in their stool quality really rapidly. And we also have high fiber diets from other brands, things like Purina EN Fiber Balance and Royal Canin Fiber Response. So those would be some options that I think about. But yeah, remember, if you have access and you're able to get the product guide, which is really accessible on hillsvet.com, it's really nice to be able to just go online and look at those numbers. But yeah, compare your total dietary fiber. You might be surprised. Maybe the dog's on a commercial diet and that commercial diet is already really high in fiber, as some of them are, like especially a weight loss diet. So that's, I guess, a point that I didn't bring up yet is really good to know, like, where is your patient starting off with in terms of their current diet? If they're already on like a really fiber rich diet, maybe switching them to a veterinary therapeutic fiber rich diet may not be kind of the first thing I would reach for, because we might have already said, like, they're not really responding to fiber. Let's try something else.
Sure. And I think that actually kind of dovetails perfectly into the next thing I was hoping to talk about, which is client communication around these diets. Because, like you mentioned, we might not always get the right diet on the first try when we're trying to manage these chronic enteropathies. So, especially considering owners who, maybe are starting to get frustrated and they're going, my dog is still having these loose stools or it's intermittent, whatever it may be. How do we kind of communicate this to them in a way that's encouraging and keeps them on board without making them feel like they want to throw their hands up because they're like, I don't want to try a million different diets?
Yeah, no, I think that's a really good point to bring up, because most of the management and the improvement that we're going to see in these dogs is going to happen at home, and it's going to take a little bit of time. I think the two biggest strategies that I use that I think helps me be successful to help these patients, one would be to start off with kind of realistic expectations. Let them know the background that, again, in all the patients that we see, big populations, it seems like 70-80% of dogs can get really good remission from their clinical signs, really good quality of life with diet. And so that's kind of like the context that we think about all of this in front of. However, it may take time to find that right diet. I think the good news is, for GI disease, unlike something like dermatologic issues or atopy, we only have to be really strict with the diet for about 10 to 14 days. If things are not substantially better within that initial window, then we can really move on to the next thing. And that can be challenging because, maybe they've invested in a bag of therapeutic dog food, which is not cheap. However, I do think sites like Chewy are really good about doing returns. If they say, my dog, one, didn't eat this, or it made the diarrhea worse, I think they could probably get refunds for those types of things. But again, I think also keeping that kind of diet trial period pretty short will help with compliance and avoid that like weariness of like, nothing's working. Maybe I'll just like give them Tylosin or just like give up because I'm just at the end of my rope. And I don't blame people, because, if your animal's having diarrhea, getting up in the middle of the night, like that's very, very disruptive, and it's not fun for the patient either. So to kind of summarize that, it would be, think about overall, we have a really good chance of helping the dog with diet. We only have to do it for about 10 to 14 days, and then we can move on. And I think that really brings us into thinking about, okay, first diet fails, what are we going to do for plan B? And my recommendation there would be to try to hit off like different categories. So maybe we've already tried high fiber. Maybe next we think about like a lower fiber, hydrolyzed protein diet, as, individuals may or may not tolerate fiber. It might help one patient, like you mentioned, it might be challenging to kind of digest or absorb for another patient.
Sure, and kind of not going within, I guess, one category of
Right.
diet, so to speak, but kind of switching our approach to say, what's going to work for this patient specifically.
Yep. The only other thing I'd add there is that diets are complicated things. And though I talked about these three categories, like the ingredients, the macronutrients, and the format, usually when we change one thing, we're changing other things also. So I guess that's me contradicting myself a little bit. Maybe they failed one hydrolyzed protein diet, but actually that was like the highest fat hydrolyzed protein diet. Maybe then you want to pivot and say, I think maybe that hydrolyzed protein benefited them, but it was just too much fat for them to handle. Maybe I'll try something like Hill ZD low fat, which also happens to have kind of like a middle of the road fiber content. So that's actually a diet we've been using a bit more recently because it kind of checks a number of different boxes in terms of novel protein, middle of the road fiber, and then really, really low fat content, which can make it a lot easier for these kind of patients to absorb.
Oh, yeah, it's a good point. I didn't think about that, but yeah, it kind of checks a lot of boxes and
Yeah.
gives you a good chance for getting that solution. My experience is, yeah, when we get a couple of maybe too many diets that aren't working or owners feel like they're not working, that's when the owners are like, I'm going to try a raw diet. And I'm like,
Yeah.
oh no, now we're really going back to square one.
Yeah.
I'm glad we talked about client communication because all the more important to keep them on board and try to get this long-term resolution for these pets. Well, this conversation has been full of a ton of useful information that I think gives us just good practical ways to look at these patients and work through what can be a really frustrating condition and help talk owners through it. But of course, our conversation is focused a lot on dogs because dogs tend to be the ones that are pretty amenable to dietary therapy and the ones that are they tend to eat a little better than say our feline friends who can be a little more on the picky side. So while I 100% recognize that talking about chronic enteropathies in cats is probably its very own podcast episode, so we can't get into a ton of depth here, do you have just some pearls that you can leave us with in terms of maybe just where to start when we're thinking about cats with chronic enteropathies?
Yeah. Yeah. And I don't want to ignore cats. I'm a proud, very happy cat owner, and I am a cat owner of a cat who has struggled at times with some chronic vomiting. And that's pretty frustrating. It's very upsetting to like see her and hear her vomit. And so I really empathize with owners dealing with those types of issues. But while I would say there's not as much published data, and I don't think it's talked about nearly as much, I think we do still have a really great opportunity to help cats with their GI signs with diet. I do think we have to be a bit more patient and a bit more like attuned to the cat's preferences when we're doing that. Typically with the dog, I can feel pretty confident. I send him home with one diet that I think is going to work, and I'm pretty sure they're going to eat it and be happy with it. Cats, and yeah, my cat, certain wet foods she'll eat right out. Others she's like, what are you thinking about? So, um, in that way, and knowing that cats can have like a neophobia, so afraid of things that are new or averse to them, I think it's really important to kind of offer the new and the old food next to each other at first. We also could keep more of an open mind and maybe think about 3 diets that might help that individual cat and then kind of stepwise go through those, see which one they find palatable, and then give it a shot for a few weeks if possible. I do think we have a lot of, again, potential benefit with fiber for cats with GI issues. I think, when we see those hairballs when they're vomiting, that likely has some kind of cause from a disrupted GI motility, and fiber, again, can really try to help normalize that. Something we didn't talk about with dogs, a really common problem with cats would be more of like a firm stool or constipation. And again, fiber and hydration are really going to be our friends in terms of drawing more water into the colon, allowing for like softer stools that would be easier to pass. So I think that really caused us to go back to the beginning and realize the importance of a really thorough history. I would think if a cat wasn't having like a stool in the litter box every day, that would be something an owner would bring up. But, maybe they haven't had many cat pets before, they have a really busy household and don't notice. But that could be a real red flag that, like, ooh, this cat is probably struggling with some sort of enteropathy that's manifesting as constipation. And with added fiber in the diet and making sure they're staying hydrated, they have lots of water sources, that could really help their clinical signs.
Absolutely. Cats just, especially when they're in the clinic, they don't like to give us a lot of clues in terms of what's going on. And so making sure that we're asking those questions and getting really thorough. Sometimes those are the only clues we'll get in terms of what the problem is with this cat.
Yeah, yeah, cats are great little they're going to hide things until things are really bad. And I would love to be able to intervene sooner so that we're, maybe switching the diet, finding something that agrees with them more rather than waiting until they're like, they've lost a kilogram, they're puking after every meal, we have to go to endoscopy, things like that.
Absolutely. Absolutely. Gosh, there's so many places my brain goes there in terms of cats and, ways that we can get more information sooner and communicate with clients. But like I said, I know that's a whole episode in and of itself and a whole conversation. So I hope that we can have that conversation
Yeah, that'd be
sometime,
great.
but to be sensitive to your time and to everyone listening, I will restrain myself and not go down that road. But thank you so much, Allison. This has been such a great conversation. I really appreciate all of the information. Are there any final thoughts you want to share?
Yeah, I think I would just, yeah, really empower listeners to trust that you can have a lot of great benefits from diet for dogs with chronic enteropathies as well as cats, and really empower you to have those conversations with owners. One thing we didn't get to touch on was that these conversations take time and that may be challenging within your practice schedule. So, yeah, can we utilize nurses, technicians in our clinic who are passionate about this topic? Do we set up an additional telehealth meeting where we can talk through some of the details? I think follow up is super important. You're in general practice, you probably know better than I do how to get through and be efficient with these types of really critical conversations.
Well, I think what's so neat about the whole conversation here is there's a lot of opportunities for creativity and critical thinking,
Hmm.
and we can really dive into ways that may be outside of the norm of what we've thought about up to this point to help these patients, but really be rewarding both in terms of getting to use that creativity and those critical thinking skills and and then we really get to benefit some patients and hopefully get away from the antibiotics and things like that. So yeah, I feel informed and empowered after everything we've talked
Awesome.
about here.
Yeah, that's why I love working with and studying GI disease because I do think it is so rewarding. Like owners talk about their dogs like personalities changing and they are like, oh my gosh, I never knew he actually now like one dog I see, she's like, now he's a chow hound. And they always used to think he
Oh,
was just like, nibbled at food, was an easy keeper. So yeah, I think that's like the light at the end of the tunnel. So super glad to be able to have this conversation.
Dr. Manchester, thank you so much for joining me. I truly enjoyed the conversation. A big thank you to Hill's Pet Nutrition for making this episode possible, and thank you to everyone out there who tuned in. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcasts. It'll help other veterinary professionals like you find this and other great content we try to put out there. For more episodes like this, click on the Education tab on the VetFolio website or find us wherever you get your podcasts. We're always eager to hear your thoughts and ideas for future episodes, so feel free to reach out to me at dvm@vetfolio.com. We can connect on Facebook at Dr. Cassi DVM or follow me on Instagram at dr.cassi.dvm. And remember, if one animal is better off because of you today, it's a great day.